Welcome to the Mended Heart Sync Share Your Heart Heart Health presentation. Jim Rohn says, take care of your body. It's the only place you have to live. Let's talk about your heart. Question: what side of the body is your heart on? Left side, right side, outside, or backside? If you said left side, you are correct. For most people, the heart is on the left side of the body. People who have a congenital heart defect called dextrocardia have hearts on the right side instead of the left. Nicholas Sparks says, always listen to your heart because even though it's on the left side, it's always right. Question: how many chambers does a human heart have? 14, 2, 4, or 8? If you said 4, you are right. We can look at the heart using a Valentine's heart. The heart has 4 chambers. Chambers are like rooms of the heart. On the top, you have the right atrium and the left atrium, and the bottom 2 chambers are the right ventricle and the left ventricle. The heart also has 4 main valves. Valves are like doors that open and shut to let blood go through in the right direction. In your heart, you have a tricuspid valve, a pulmonary valve, a mitral valve, and an aortic valve. Here is an image of the outside of a human heart. Here is an image of the inside of a human heart taken at a cross-section. Question: what is the main job of the heart? To digest food, to create a beat for dancing, to filter waste, or to pump blood with oxygen and nutrients to the body? If you said to pump blood with oxygen and nutrients to the body, you are right. The heart's job is to take blood from the body, pump it out to the lungs, and back into the heart and out to the body. The right side of the heart pumps blood from the body to the lungs to get oxygen. The left side of the heart pumps blood back from the lungs into the heart and to the body. The heart also has an electrical system that controls the heartbeat to help pump blood through the heart. Question: what is the name of the large blood vessel that takes blood with oxygen from the heart to the body? The big vessel, the aorta, the pulmonary vessel, or the oxygen carrier? If you guessed the aorta, you are correct. The aorta is the main and largest artery in the human body. It carries oxygenated blood to the body. The aorta has an ascending aorta at the top and a descending aorta at the bottom that takes the blood to the bottom half of the body. Another main vessel coming from the heart is the pulmonary artery that carries blood from the heart to the lungs to be oxygenated. Question: what is a normal resting heart rate for children 10 years and older and adults? 200 to 220 beats per minute, 30 to 50 beats per minute, 60 to 100 beats per minute, or 999 to 1,000 beats per minute? If you said 60 to 100 beats per minute, you are right. Question: what is a doctor called who specializes in studying and treating hearts? A heartologist, a special doctor, a pediatrician, or a cardiologist? If you said a cardiologist, you are right. A cardiologist is a doctor who specializes in treating and studying heart disease. Heart disease is the leading cause of death in the United States. Coronary artery disease is the most common form of heart disease. 18.2 million people over the age of 20 have coronary artery disease. Cardiovascular disease can consist of structural heart problems like valve problems, heart failure, cardiomyopathies, and congenital heart defects, circulatory problems like coronary artery disease, atherosclerosis, and hypertension, commonly known as high blood pressure, electrical problems like heart rhythm problems, or chest pain called angina or angina. Let's talk about taking care of your heart. 80% of heart disease is preventable. Some controllable risk factors for heart disease are unhealthy eating, being overweight, smoking, lack of exercise, and stress. Please note that some people have conditions where they cannot control some of these risk factors. Heart disease risk factors you can't control are age, genetic conditions, family health history, menopause, congenital heart defects, and race and ethnicity. Question: what kinds of foods are good for your heart? Candy, fruits and vegetables, ice cream, or Scooby snacks? If you said fruits and vegetables, you are correct. Eating fruits and vegetables helps your heart stay healthy. You can go to choosemyplate.gov and see a plate with examples of how much of each food you should get each day. Question: what can you do to keep your heart healthy? Watch TV all day, play video games, sit on the couch, or exercise? Hopefully that was easy and you said exercise. If you can, try to exercise every day. Find exercises that are fun to you and you are more likely to exercise. There are guidelines as to how much exercise each person should get on cdc.gov. You can also talk to your doctor about what kinds of exercises are best for you. Also, find ways to manage and reduce stress in your life. Some things that may help are taking a walk, meditation, journaling, exercise, talking to others, and resting. Make sure that you get enough sleep each night as well. If you have heart disease, get support. Educate yourself about your heart disease and become an advocate for yourself and others. People who have heart disease can lead happy and enjoyable lives, as you will see. Here are many people with heart disease living their best life. And here are people born with congenital heart disease who are also rocking their scars. both physical and non-physical. If you want to learn more about heart disease, we have the Mended Hearts Heart Guide. This guide can be found at www.mendedhearts.org. In addition, if you want to learn more about congenital heart disease, you can look at the Mended Little Heart Guide. This guide can be found at www.mendedlittleheartguide.org. In Mended Hearts, we have 3 programs, so you are not alone. We have Mended Hearts, Young Mended Hearts, and Mended Little Hearts. Mended Hearts, Young Mended Hearts, and Mended Little Hearts inspire hope and improve lives of heart patients and their families. We do this through support group meetings, hospital visiting programs, heart disease awareness, community events, educational programs, and advocacy. There is incredible power in peer support. One Mended Hearts member told us, "My biggest fear after finding out I had heart disease was not being there for my family. With Mended Hearts, I was able to make some good changes and reduce my risk. It helped me enjoy my family more too." Mended Little Hearts program is for parents and families of children born with heart disease. One parent said, "Before I got involved in Mended Little Hearts, I thought I was the only one who felt the way I did. I was so relieved to find out it wasn't just me. Talking to parents who have been there can make a huge difference." And our new Young Mended Hearts program is for patients between the ages of 18 to 55 who have heart disease. One of them told us, "After my son's stroke and facing open heart surgery, Young Mended Hearts welcomed me into their group when I needed them most. I'll never forget how relieved I was to see all those beautiful faces gathered around the table with their surgery scars peeking out from their necklines. They saw me through the surgery, the recovery, and beyond." Remember, if you need support, with Young Mended Hearts, you can get hope, help, and healing. With Mended Little Hearts, we know that little hearts hold big hopes. And with Mended Hearts, our motto is "It's great to be alive and to help others."